everyone. Thank you for joining us for today's webinar. This event is a project of the Global Pain Specialists and Associates. I am Dr. Carmi Margaret Marshall, and I will be one of your moderators this morning. It will be my pleasure to moderate alongside a veteran moderator, no less than can we show the slide of our moderators? No less than the past president of the Pain Society of the Philippines. He is also the past chair of the Philippine Board of Pain Medicine and an active consultant in pain and palliative care in St. Luke's Medical Center Global City, Makati Medical Center, and Asian Medical Hospital. He is allegedly a full-time marathoner and a professional and player wannabe. Ladies and gentlemen, a mentor of mine in pain and in life, the Dr. Henry Liu.
Well, allegedly is a nice term because it has a very nice legalistic way. Yes, I did marathon many years ago. And when I say marathon, it's 42.2K, not the 5K marathon. And yes, I want to be a professional tennis player, but that's just a dream. I started playing tennis when I was in my 50s. So I guess the ship has sailed, came back, sailed and sunk. So it's not going to happen in this lifetime. But what I do know is it's a privilege and an honor to co-host, co-moderate this event with you. So to our friends and colleagues in Visayas and Mindanao, maayong buntag sa inyong tanan. To our friends here in Metro Manila and the beautiful island of Luzon, magandang gabi po. Magandang umaga po sa inyong lahat. We are very honored to be here, and we're pleased that you're able to join us today, because we do have a very distinguished speaker, live all the way from Southern California. I've been trying to get her as our speaker for the last 2 years because of her hectic schedule. If there was no way you can get her, but finally we were able to get her today. So we are very fortunate to have her as our speaker for this morning session activity. And she's actually she's the director of nursing research and education and a professor of the City of Hope Medical Center. This is Southern California. And she has over 500 publications in peer-reviewed journals and texts. She's the principal investigator of the End of Life Nursing Education Consortium, the famous LNEC program. They went almost like 100 countries already. She has authored 12 books, including Oxford Textbook of Palliative Nursing, 5th edition, was published in 2019. In 2013, she was named as one of the 30 visionaries in the field by the American Academy of Hospice and Palliative Medicine. And most recently, in 2021, she received the Oncology Nursing Society Lifetime Achievement Award, and she was inducted as a living legend by the American Academy of Nursing. That's amazing. So without further ado, live all the way from Los Angeles, California, to talk to us about communication skills for assessment of pain and symptoms. Please welcome Dr. Betty Ferrer.
Hello, everyone. Thank you so much, and I'm really glad to join you. Being invited to be here this evening made me think back on many wonderful memories that I have from my 2 visits to the Philippines, which I enjoyed very much. I have to say that being with you by Zoom is great, but already I'm missing all of the wonderful food that I always enjoyed in the Philippines. So it's not quite the same, but I'm really glad to be here with you this evening. I tonight am going to share, tonight my time, I guess it is morning your time, I'm going to share with you some of our work in the area of pain management that focuses on communication. And as we think about this field of pain management, and I know you've had many other webinars over the period of time, when you think communication, I think it's easy for us to immediately think, oh, communication with patients. Yes, we communicate with patients about psychological concerns or grief or telling them their diagnoses. But we believe very much that good communication skills are necessary for every aspect of patient care, including good pain management. And so the work I'm going to be sharing with you comes from a communication training program that we are carrying out through City of Hope. It is an interprofessional, so we teach different disciplines, and the focus is on good communication in every aspect of care, in pain management, symptom management, bereavement support, supporting family caregivers. And so I'll be sharing with you some thoughts about how we can all use good communication skills in order to do a better job of pain management. And so I am going to share my screen now, and we are going to hopefully get to the slide. So this may take just a minute. And can someone tell me if you are seeing the slides?
The slides are not on the screen yet, Dr. Farrell.
Okay, let's see
Let's try
here.
one more time.
Okay.
While we're waiting for the slides to upload, I'll just say hi again to our participants and remind that you can have your questions placed in the chat box, and please type them and we will try to answer during the Q&A portion. Okay. This is what happened again during our run earlier. We can stop share screen and try again, Dr. Farrell. Thank you.
Okay.
So for Dr. Liu, how many participants do we have right now?
Right now we have 268 and still coming in.
And still coming, yes.
Yeah.
Everybody's excited.
Yeah, remember this is the first time to do it in the morning. Usually we do it
At
late
night.
afternoon where people are less busy. So
Are you still not able to see the slides?
No slides yet, Dr. Farrell.
Okay. I think we'll try one more thing, and then if that does not work, we might need to go to you.
Yeah, we have the backup files.
Right,
Yeah,
okay.
sure. We will control it from our end. Sure.
Okay, we might try one more thing.
It worked earlier, so for sure. All right. The same thing went. Maybe we can use the slides that you sent us.
Okay, you're still not seeing them?
Yeah, we're seeing another file.
Okay.
All right. Do you want to try one more? Yeah, there you go. Now the slides are on.
Now they're on. Okay, wonderful.
Yeah, okay, good.
Okay, thank you everyone for your patience. So we are going to talk about communication skills for pain and symptom management. And let's see, it's not letting me advance. So is there something we can do about that? There we go. So we're going to apply some principles of communication to one of the key domains of palliative care, which is physical aspects of care. And then we'll talk about some strategies for teaching communication to other people, to our students and trainees, so that they can also improve their communication skills as they care for patients with pain and other symptoms. It's not letting me advance still. Oh, there we go. Maybe it's just delayed. So as we think about pain management, I think all of us are very familiar with, while we want our patients to have good pain and symptom management, often there are barriers. There are things that get in the way of our patients really getting the best pain management possible. And some of the barriers that we know are the patients and family members themselves. So I'm sure each of us on this call could pause and think about what are some of the reasons that we are often challenged in pain management. So for example, patients or families who may be afraid of taking pain medicine, or patients who don't want to admit they're in pain because they don't want to upset their family, or often patients who don't want to admit that their pain is worse because they may think that means they're getting worse. So those are problems that patients may have that interfere with good pain management. And yet immediately when you think of these issues, patients who are denying their pain, patients who don't want to talk about their pain, we know that it's going to take some good communication skills. We also know that we as healthcare professionals may be the barrier, that we may not be doing the best job of really listening to the patient, hearing their story, and understanding how their pain is impacting their quality of life. And finally, the healthcare system. We know there are very real issues with how busy everyone is. So busy now and so burdened with staffing shortages, and post-COVID, we're all really reeling in being overworked. And so we may not have the time. I think now we're all very, busy with the electronic medical record and looking at our computer screens and iPhones. And so again, are we taking the time to really make eye contact with patients, listen to them, describe their pain to us, and communicate with us things that we can do to better relieve their pain? We're going to now start by watching a short video clip. It's just a couple minutes long, but in this video clip, you will hear a patient describe his experience of having chronic pain.
Recording in progress.
Dr. Farrell, can we increase the audio a bit? It's not on my end only.
Yeah.
There you go.
Pain's one
Thank
thing.
you.
Most people experience pain in their lifetime. Chronic pain, though, is a whole different animal. So for those of us that have had that and then get relief from it, it gives us back our ability to really enjoy a lot of life. And it's wonderful. It's like it's a wonderful gift. Well, we always, talk about pain on a scale of 1 to 10. And mine was resonating at the top for a very, very long time. 10 was not unusual.
Don had a lot of really severe physical pain. The cancer had actually eaten into nerves coming off of his spine and caused a really severe form of pain, a lot of burning, radiating pain. And it took a combination of medicines to try to get that pain under best control pharmacologically.
It's all-encompassing. It can take your life away from you.
1 in 5 Australians have chronic pain. And I have confidence that the same situation exists in most other developed countries. Of those 1 in 5 people, 1/3 of them are severely disabled to the extent that they have disability equivalent to people with congestive cardiac failure, and very often in excess of those of congestive cardiac failure. Now, this is something I think that most people in the community just don't realise.
The research has shown that chronic pain then moves on to insomnia. So when people's sleep patterns are disrupted, their general quality of life begins to decline if the pain isn't addressed.
Debilitating pain for me starts, again, on that scale at about 8. And with the right medicine, you can take it down to a 3 or a 4.
When you see a patient coming in with chronic pain, you don't realize how severe his pain is. You know, when it's acute pain, it's all there in his face, he's sweating in colors and so on, but chronic pain is not like that. And it might, you know, not so striking, it might go neglected, but when you ask, you are amazed what is really happening with that patient.
When you move from acute pain onto the chronic pain situation, you are now dealing not with a symptom, but you're now dealing with a disease in its own right.
The absence of opioids in a chronic pain situation, I think would be unbearable. I think that, goodness, I think it would be easier to die. Absence of pain, at least in my case, that's a dream. But definitely with the right expertise, with the right doctors, that pain should be more than manageable.
So as we think about this patient and we heard the patient's words, you know, taking the time, even a couple of minutes, to just ask patients, tell me about your pain. Tell me how it's impacting your quality of life. You know, tell me about your pain at its worst. And what does it feel like when your pain is at its least? These kinds of questions and listening to the patient's own words can just be an enormous part of our pain assessment. So I'm sure you've all seen these definitions. Some of these are very old, from the International Pain Societies, that pain is an unpleasant sensory and emotional experience associated with actual or potential tissue damage. And so we know there's an enormous emotional component. And when we often use the terms pain and suffering together, because most pain leads to suffering, if not relieved. Also, the definition that pain is what the patient says it is when he or she says that it does. So this is a reminder that while pain may be a neurological event, it may be a biological experience, it very much is also a psychological and a social experience. And so our pain assessment should also really encompass these realms. If we really want to know about the patient's pain, not only will we do a good physical assessment, but we will do a good assessment of the impact of that pain on the patient psychologically, socially. For example, how does this impact your ability to interact with your family?
Yes, sir. Okay.
As we think about pain management, one of the things that we often think about are who are the patients that are at the greatest risk of having inadequate assessment or treatment of their pain. And so when you look at this list, you see that patients that are very well recognized at being at risk or under assessment or under treatment include older adults, children, anyone who is of a different race, ethnicity, or language from the clinicians that are caring for them, people with a history of substance abuse, anyone who's nonverbal or cognitively impaired, and also people who have financial limitations, uninsured, underinsured people. And so a lot of focus has gone on over the years in our national pain guidelines and pain education and training programs to understand the unique issues of pain in the elderly and children, pain in infants, so pain in each of these groups. So it's really important. We need good assessment skills and good communication for all patients, but I think it's important for us to think about these special patient groups as also really needing excellent communication skills. So one of the things that we've learned over the years in communication is how important it is to really assess the whole person. And so, how often do we meet a new patient and, we might introduce ourselves, hello, I'm Dr. Smith, but then immediately we start asking them, tell me about the pain in your back, or what medications are you taking? So we immediately start asking about their pain or their medications or their underlying medical condition. But it's always a good idea to start by really learning about the human being in front of you, assessing the whole person. And so as we begin a pain assessment, we encourage our clinicians to really pause and assess the whole person. So I know that